I should like to congratulate Dr. Etienne on her appointment as Regional Director for the Americas for a period of 5 years, as from 1st February 2013, and to convey our best wishes for your continuing success in all your endeavors in the region. Dr. Etienne, may I invite you to come forward.
I solemnly swear to exercise in all loyalty, discretion, and conscience the functions entrusted to me as an international civil servant of the World Health Organization, to discharge those functions and regulate my conduct with the interests of the World Health Organization only in view, and not to seek or accept instructions in regard to the performance of my duties from any government or other authority external to the organization. So help me God.
Let me first and foremost extend my warmest congratulations to Carissa, to Dr. Carissa Etienne. Chair, I have lost my Assistant Director General for Health Systems and Services. The Pan American Health Organization has gained an experienced leader. PAHO will be in good hands. I know Carissa well. I know her personal biases, which stress the right of poor and marginalized populations to access high-quality health care. I know her passionate commitment to primary health care, to the value it gives to equity, social justice, and solidarity, and to the emphasis it places on multisectoral action and, above all, community participation. You have heard her just now. Carissa is someone who never forgets the people. During Carissa's years in Geneva, I had the great pleasure of seeing how the concept of universal health coverage captured the attention and inspired the commitment of a growing number of governments at every level of development. Many attributed the recent high profile of universal health coverage to the 2010 World Health Report on health system financing, produced under Carissa's direction. All of these qualities make her extremely well suited to direct an organization like PAHO that cares so greatly about equity in health, the right to health, and Pan-American solidarity. Carissa inherits a very healthy organization that has gone from one excellence to another. I thank my sister, Dr. Mirta, for contributing so much to health in the Americas and for never wavering in her personal commitment to primary health care. I learned a great deal from her commitment, leadership, and vast experience. Well, I was reminded to be short and stop before I cry. I shall do so. So let me wish you, Carissa, Mirta, PAHO, and the people of the Americas all the very best. Thank you.
Thank you. Madam Chairperson, distinguished members of the Executive Board, Excellencies, colleagues, ladies and gentlemen, good afternoon. It is a good afternoon. It is a great honor to be appointed Regional Director of the WHO Americas region and Director of the Pan American Health Organization. Let me first thank the member states of PAHO and the WHO Executive Board for granting me this opportunity to contribute to the health and well-being of the people of the Americas, a region that is playing an increasingly important role on the global stage, both politically and economically. As a young medical doctor on the tiny island of Dominica, I was passionate about service, but never dreamed of this possibility. Now, with more years of clinical and public health experience than I care to count, I look forward to this new challenge with fortitude and commitment. A little history. I first worked in my country's national health system, then as Assistant Director of PAHO, and most recently as Assistant Director General of the Health Systems and Services Cluster here at WHO. This has all provided me an education in how WHO can best work at its 3 levels to ensure maximum impact for the people which it was established to serve. Throughout my working life, I have seen how important it is for health systems to evolve to meet contemporary health needs. I was part of the movement which reformed healthcare in my country. Many other PAHO countries have taken similar steps and have rich experiences to share with others. There is strong political commitment to achieve health goals across the region. Indeed, many nations of the Americas have enshrined the right to health in their constitutions, and many have made significant advances in improving access to health services. They rightly focus not just on preventing and treating health conditions, but on the need to address the social and environmental determinants that directly impact on health. A willingness to embrace innovation and to aim high has helped countries in the Americas eradicate polio, eliminate measles, dramatically increase access to antiretroviral treatments, and to meet the health-related Millennium Development Goals at the regional level, with the exception of maternal mortality. I will continue to work with the member states to develop new and innovative approaches to deliver results with increased efficiency and coherence, and to share these experiences with all of WHO. PAHO member states acknowledge that their achievements are not even. Within and between countries, persistent fundamental inequities mean that wide health gaps still exist. As regional director, I will work with countries to address these imbalances and to prioritize vulnerable and marginalized populations. I believe that a rights-based approach to health is critical to ensuring fairness. We will require to broaden our focus, learning to engage and work across sectors with a wide range of partners, both state and non-state. Such an approach will be critical to completing the so-called unfinished agenda, notably tackling communicable diseases and improving maternal and child health, as well as tackling new and emerging challenges and confronting the chronic non-communicable diseases. Good health is rooted in equity, universality, solidarity, and inclusiveness. I have learned from many countries that universal health coverage is not only the best way to improve the health of every citizen, but that it is entirely feasible. Let me be clear. Providing universal health coverage means ensuring that the entire population has access to necessary health services, prevention, promotion, treatment, and care without fear of financial catastrophe or impoverishment. It requires the establishment of social and financial protection mechanisms, a robust, well-trained workforce throughout the country, organized service delivery networks, and reliable supplies of safe and efficacious medical products and technologies. It means maintaining strong health systems. This approach embodies the fundamental principles of primary health care, provides a framework for the progressive expansion of access to essential health services, and constitutes an overarching umbrella for all health programs. It is wholly consistent with our mandate under the WHO Constitution. It is indeed my fervent hope that member states will ensure that universal health coverage is prominent in the post-2015 development agenda. It is a truism to say that universal health coverage requires political will. Yet, the really important aspect of this political will is that it depends not merely on the commitment at the highest political level, but equally on the political will of district and local authorities and of communities themselves. But if they are to manifest that political will, communities must be empowered to do so. Over the years, I have often been frustrated by piecemeal approaches to strengthening health systems and services. Health systems are like cars. You can have the shiniest car body in the world, but if the brakes don't work, or if the steering doesn't work, you're not going to get far out of the garage. I have also been disappointed by tendencies to second guess or even ignore the needs and expectations of peoples from all walks of life. In development circles, there is much talk about country ownership. I pledge that as Regional Director of PAHO, I will strive to make country ownership a reality and to work that all stakeholders have a seat at local and national health decision-making tables. I am excited by the prospect of implementing new approaches to expanding technical cooperation. Many PAHO countries have tremendous capacity, and I look forward to strengthening networks and instituting mechanisms to facilitate exchange of skills and experiences, not only within the region, but with other WHO regions as well. I think we all stand to benefit from this. In September, when I spoke to the PAHO Sanitary Conference, I spoke about change. I recognize that I am fortunate to be taking the reins of a strong organization which is respected for its work. In this regard, I pay tribute to the current director, Dr. Roses, as well as to the previous PAHO directors. I look forward to leading the PAHO in this increasingly fast-evolving era of public health and to making the organization more effective, more accountable, and more transparent to its member states. I'm fully committed to working with the member states of PAHO and other regions and with my WHO colleagues to take PAHO and the wider WHO forward to meet the challenges of the 21st century. Lastly, permit me to thank the many governments and individuals that have helped me during my tenure as Assistant Director General for Health Systems and Services in WHO. I wish to thank WHO staff across the House, Dr. Chan, my fellow ADGs, and all those working and who have worked in my cluster. I think they all deserve a special thank you. Among our joint achievements, I must mention the 2010 World Health Report on health financing for universal health coverage, the Code of Practice on the international recruitment of health personnel, the reinforcement of the WHO pre-qualification program, the strengthening of WHO's support to national health policy and planning processes, the first ever WHO policy on health systems research, and the further development of the International Health Partnership to improve aid effectiveness. Madam Chairperson, Excellencies, and representatives of member states, I look forward to continuing our work together in the Americas and beyond. Once more, thank you.